And I'd like to establish that we have a quorum. Pam, do we have a quorum today? Yes, we do. So this meeting is officially called to order. And I'd like to have approval of the agenda.
Make a motion to approve the agenda.
Second.
All in favor say aye.
Aye.
Opposed? The agenda is approved. And I'd like to ask if when we make motions and second motions that you identify yourselves for minutes taking. It makes it much easier when we're transcribing this later. So thank you for that. Thank you very much. And we need to approve minutes of the previous meetings from the July 16th meeting. Those are shown in the packet that everybody has in front of them.
This is Dr. Dorman. I'll make a motion to approve the minutes from the July meeting.
Thank you. Do I have a second?
Second. John Helvin, Los Lunas.
Thank you, John. All in favor say aye.
Aye.
Opposed? So the minutes of the previous meeting are approved. Thank you. So now we're on to item 4 on the agenda. Before we do that, though, I'd like to have introductions. I'd like for people in the room to introduce themselves and people on the phone. We're going to start with people on the phone. Who's with us today remotely?
Hi, this is Janet Wells. I'm the Human Resource Director at New Mexico State Veterans Home, and I will be providing the report today for our interim administrator, Donna Deason, who is out on leave.
Thank you, Janet. Who else is on the phone?
Good morning, this is Mia Chavez from OGC.
Thank you, Mia. Anybody else on the phone today? All right, and in the room today, I'm Retta Ward, the Cabinet Secretary, and we'll start to my left, Brad McGrath.
Sure, I'm Brad McGrath, Administrator here in Roswell. Thanks to everybody for being here. I think a few more probably coming in a couple minutes.
Good morning, I'm Jeff Lara. I'm the Southeast Region Director for Public Health Division.
My name is Shauna Hartley, and I'm the Administrator at Turquoise Lodge.
I'm Alice Sandoval, I'm the Administrator for Sequoia Adolescent Treatment.
I'm Pamela Bromer, I'm with Office of Facilities Management.
Marie Castillo with the Office of the Secretary.
I'm Mark Williams, I'm the Director of the Public Health Division in the department, and Jeff and I are here partly because there's probably some synergies between the big operation we have and the big operation that facilities have, and it just seems like maybe there's opportunities that would be good for us to be a little bit more plugged in with you all, so we just took the invitation and decided to come.
Thank you.
John Helvin, Administrator, Los Lunas.
Steve Dorman, Chief Medical Officer, Department of Health.
Jose Grohl, NMDOH Credentialing.
Troy Jones, NMDOH Administrator.
Kim Polanco, Facilities Finance.
Kathleen Luttrell, Administrator for Baird Medical Center.
Esther Gutierrez, Director of Nursing for Baird Medical Center.
Thank you. And?
I'm Dennis Habe, I'm with IT.
Thank you. Thank you for your assistance today, Dennis. Anybody else join us by phone? And for those who are here in the building, the bathrooms are out to the right and then out to the right again. We have snacks over here. Help yourself anytime. And we will be having lunch at the end of the meeting as well. So everybody's welcome to join us for that. And thank you to Brad and your staff for providing the meeting space and for your hospitality today and
We can
in
do
hosting
tours
us.
too at 12 if you
And
like.
we can do tours
Won't
as
take very
well.
long.
Tours and lunch. It doesn't get any better than
No,
that. That's a great combination. So now we're on to item number 4, new business reports. I just have a brief update that I want to thank everybody for the work that you're doing in terms of prepping us for the new legislative session. Starts in mid-January. Hard to believe we're reaching that time of the year again. And I know that we're putting out some big stretch goals for everybody in terms of revenue, and you're stepping up, and I really appreciate that. So I'm grateful for all the efforts that are being put in to help us enhance our revenues and improve our census and improve all of the quality initiatives that we have going on. We're making big progress in the facilities, and I'm grateful to each of you for the work that you're doing in that regard. So thank you very much. We're going to move on now to facility administrators' reports, and we'll start with New Mexico Behavioral Health Institute. Troy?
Okay. Actually, it says page 1, but it's not. It's page 1 after all of the other documents that were reviewed previously, if you want to follow along. I'll
I'll go through just real quickly in regards to our census. Over last quarter, we had 190 admissions to our adult psychiatric division, 195 discharges. We're averaging around 80 individuals in last quarter. In our adolescent unit, we had 1 admission, 2 discharges. We're averaging 9. Our goal in there is to be at 11. They have done a lot of outreach down south and have some referrals, so I'm hoping to bring that number up. In our forensic division, we had 20 admissions, 22 discharges. We're running an average census of 50. Our 1.5 population that most of you are aware of, individuals found not competent, not restorable, yet dangerous, can be placed with us for what would have been the maximum sentence if they had gone through the judicial system and been found guilty. We have 35 of those individuals with us. Out in our outpatient community mental health center, we had 100 admissions. We're running a little over 1,200 active patients right now. Our nursing home, we had 11 admissions, 8 discharges. Our average census is 146. You can see that we're steadily climbing as we go along, trying to get to the 150 to 152 number, plus our INS. The projects and constructions and capital outlay, we actually did receive $16 million for phase 3 of Meadows. There was going to be a slight delay. They have to go through an RFP for an architect. That is out to bid. We're going to have review of the bids November 9th. So hopefully we'll be making a selection shortly after that to get the architectural designs drawings done. We did also get money 2 sessions ago for the demolition of our old Meadows building. It was awarded to a local contractor, Reconstruction. And I'm expecting them to be there starting to tear the building down in November, beginning of November. We continue to work. You guys heard at the last session, or last governing body meeting, we had mold remediation and restoration that needed to be done in our forensics division. That project's well underway, and I think December is when it's expected to be completed. We do have capital monies for Tasuki, our admission areas and our extended care areas for boiler replacements. We're looking at getting that vendor awarded by the end of this month. Personnel, it looks good when we say we had 81 positions for the quarter. That only resulted in 36 new employees. The others were promotions or internal transfers. We did have a doctor that came on as a part-time family physician, Dr. Taylor. Last governing body, I reported that Dr. Chris Clancy came on as our chief of psychiatry. Well, he started in August of 15, and he resigned October 4th to go work at a community mental health center closer to his house and for more money. I put here, you guys are already aware of, psychiatric techs, nurses, social workers, psychologists, and physicians still seem to be our highest opportunity for improvement, if you will, in regards to hiring and retaining. Just some miscellaneous stuff here. The nursing home went through its annual CMS survey. We had a few areas that were identified as areas for improvement. We submitted our plan of correction. We got that back. See, yesterday or day before they sent that email to you?
That is correct.
They did the desk audit. It was approved, so we're cleared. Everything is good to go. On top of that, we actually had a life safety survey coming in for the VA. We did sign that, or trying to sign that contract for nursing home services. They have to do a life safety survey before they'll allow a contract to be initiated. They're coming in next week, Thursday and Friday, to do theirs, and I expect no problems, so hopefully we'll get that contract signed pretty quickly. Just some things here you guys were aware of. Governor Martinez came in, announced the $16 million capital funding for phase 3. Director Abbey actually came in with some of his analysts, and we gave him information about our programs, how we operate, and he seemed to be very supportive of the whole movement. You guys were all working on this pharmacy software upgrade. I attended it's called WIPSHA, Western Psychiatric State Hospital Association meeting in Utah. It's actually, I'm now the president of WIPSHA. I don't know how that happened.
Congratulations, Troy.
But we do a lot of benchmarking between other state psychiatric hospitals, and in some of the PI reports and stuff that I shared with Dr. Gorman, we're doing very well compared to our sister or brother facilities in the western half of the United States and all of our areas. So I was really glad to see that. And you guys know about ICD-10. We say it's successful, but we really won't know until we bill our first month in November. It'll be November
for October.
We'll see how October really did go, but everything looked pretty positive, so I'm not expecting any hiccups. And that's a snapshot of last quarter for NMDOH. If you have any questions, we're happy to answer them.
I have one quick question, Troy, on the 1.5 census. What is the capacity for handling 1.5s?
They're all put in the same population that we have. We're licensed for 116 beds in forensics. We're operating about, with the current demolition and restoration of the mold, I'm operating about 60 beds, and I have about 50 some odd people at any given time. 35 of those are 1.5s.
Okay.
So they're in the same population. We don't separate them out. We do have a section of those that are there for multiple life terms that are put over right now in our Crestone area because of the mold remediation, where we had our sex offender program that we put on moratorium for admission, so I can move that population out to make room when they did the construction.
Any questions for Troy?
I only have one comment. While Troy was talking in Utah, evidently the state has a electronic medical record product that they have custom grown. They love it. It is free.
It's public domain.
It's
Public domain.
Public domain, and they're willing to share it with us. So we've got Jeff Escabel working on, trying to figure out if it's going to suit our needs and any details related to that. But that is a potential replacement for Avatar that would be cost-free to us, except we would need to train local programmers to support the software, which would be a huge savings over Avatar replacement, which we really need to do so.
So Jeff Escabel is investigating that? Okay.
He's going to do it from the IT piece after he sees if they could actually gain the expertise to be able to do the maintenance on it. Then I want clinicians to look at the actual software and see what it can do and see if they're interested in it.
And Terry Reeser's plugged in on this as well? Okay, good.
Sure.
All right.
Probably some of the challenges are disconnecting someday Avatar from all the things it's connected to, right?
Right. We looked at just about all of the external electronic medical records products. None of them were really, nobody loved them all. Everybody hated portions of them, so evidently Utah has just kind of developed their own system which suits their needs, and it'll be interesting to take a look at. So that's just an FYI. No decision obviously has been made on that.
Is this web hosted and
Yes.
interoperable with other medical record systems?
I don't know.
That's the challenge.
Stuff that Jeff is going to be looking at. But it's custom designed for behavioral health, which is predominantly what Avatar is doing because we've got point-click care for long-term care. So that's kind of taking care of itself, but now we're left with all the clinical dependency, behavioral health documentation and billing abilities.
Utah wanted to take that product and develop it through Whipshaw and then have Whipshaw sell it to entities like Avatar is being sold now. And that didn't happen, and now they're willing to get it free so people can actually have a workable electronic record.
That's a great opportunity.
It is.
Any other questions or comments? And I think we've had somebody else join us on the phone. Who else has joined on the phone?
It's Secretary Copeland for me. Secretary Copeland.
Good morning.
Morning.
Who else joined?
Gabby, I'm also on.
Good morning, Gabby. And Jeremy Avarella has joined us in person as well.
Good morning.
Anyone else on the phone? Very good. All right, so we'll move on to our next report. Sequoia, Carmela?
Sequoia has been working on increasing the census over the last 2 weeks. At the time we did this report, our census was 32. As of today, it is 33.
Excellent.
Congratulations.
The projects that Sequoia is working on or completed, is a new Joint Commission standard for the 2015-2016 year is the sensitivity testing, which we completed this month. Sequoia is in the process of reprogramming the fire audible devices to be more lower chime for the residents, so it's more in line with trauma-informed care. So we're reprogramming it so it's not so loud. Recently we had an incident at Sequoia where one of our residents pulled the alarm, and so it triggers all the other residents. So we're got permission from the fire marshal to reprogram them so it's a softer chime, so in the event that happens. So that's a process because it's a programming issue. So we've in the process of doing that as well. 3 years ago, Sequoia re-roofed its roof, and unfortunately the parapets were not included in that project. So we're had to redo that, and we put some quotes on that, and that's going to cost about $25,000. Sequoia chose to do an in-house project, and which resulted in we bought the machine and trained our staff to do the parapets, and we saved the facility 90% and the $25,000, so it costed the facility about $2,500, and that was under the direction of Max Roy. We started the remodel of our third project, and that's also our third lodge at Sequoia, so we have 2 left, and that's also being done in-house and not contracted out, so we're saving some cost savings there as well. Last project that we've done is we've installed dense micro electric meters in our air handlers, so where we could control the energy and we could start being more energy efficient in our facility. So what that means is that when the education side of the building is not being used, all the air handlers will go down in the evening, doing some cost savings there. So that was also done internally. Future projects we're still looking at replacing all the locks and doors. We have submitted the cost proposals for that to General Services. We're looking at this phase 2 of electronic access, our control project, and that has been submitted as well. The air handlers for the entire facility have been done in stages, so we've done all the lodges. We did the education on an emergency project now in July. So what it remains is the kitchen, which is operating on an old swamp type air conditioner. We're going to refurbish one of the older units and install it in the kitchen, and that's also going to be done in-house as well. And lastly would be the secondary road for emergency egress and the renovation of the courtyard as well. Flipping the page, we have our vacant positions at 13, resulting in an 11% vacancy rate. We have hired, in the last quarter, we hired a teacher, a supervisor, and some mental health techs. Our current positions are nurse, social worker, psychologist, a psychiatrist, and some techs, and a maintenance janitor worker. The facility recently went through an internal audit, which identified some opportunities for billing opportunities, so those are being explored for the facility. The facility also instituted a Go Green program, and we've included the residents in this program and are teaching them some skills on how to launder their own clothes and taking care of the environment, and that's resulted in some significant changes, savings in our laundering services, and also teaching the kids some skills that they can take out because they're not going to have these types of services when they leave our facility. So that's really exciting for us. It was a rough start, but we're at our third quarter review, and we've seen some significant changes for staff and our residents. Going for our school, we welcome the new principal in our school, and he's made some significant changes and some new things at our school. We starting to send out report cards, something Sequoia has never done. So along with updating the families during treatment team, we're also sending report cards out to the families. So our first set of report cards went out the beginning of this month. We also started doing an honor list to give some incentives for our residents at Sequoia. This quarter is the first reporting to public education. So right here this month determines the funding for next year. And because our census is high and Turquoise, we also include Turquoise, the school there. Our numbers are really high, so that will generate some good funds next year for our education department. Our highlights at Sequoia, we've had a couple of guest speakers that have come who has actually sought out Sequoia to try to do some presentations at our facility, and that was, one of them is a well-known UFC fighter. Didn't put his name in here, but he actually, as part of his community service and outreach for some of the crimes that he recently did, went out to speak to our residents at Sequoia, and that was really interesting. Then we also had a Marine who had a rocky start in the Marines, and he went and spoke to the kids there. And so we have a couple of kids that are interested in the Marines, and teaching the kids that even if you have make some bad choices in your life, you can still be successful. So that was very interesting as well. I think that's about it.
Thank you, congratulations on the excellent increase in your census.
That's fantastic.
And please give our thanks to Max Roy for the excellent work he's done in terms of maintenance. That's a 90% savings in the roofing cost is phenomenal. So send him our gratitude for the great work he's doing there. Any questions or comments for Carmela?
One comment, one of our challenges with the UNM task force is to have outcomes measures for Sequoia. And one of the things that we have to really progress and present is the educational progress these kids are making. They're going literally from fifth grade reading comprehension levels to 12th grade in a couple of months. So, I mean, and it's consistent. So we need to get that data together so that we can actually advertise what progress they're making, because that is part of our outcomes.
Sure.
And it's remarkable. So that's attributed to the good teaching staff and the new principal and everything. I mean, that's really shown some positive results.
Thank you.
One thing that I failed to mention, I was wondering if it had got left out, is we have a former Sequoia employee who worked many years ago at Sequoia. He went and got a grant for music. He's a music instructor, and he got a grant on his own, and he came back to Sequoia, and he's going to be providing music classes for the kids for 45 minutes a week for every single kid and resident at Sequoia, and they're going to attain a fine arts credit for that.
That's marvelous.
And he's donating that time to Sequoia for a whole year, the entire year. So that's really
wonderful.
For the kids, and they seem really interested. We were able to secure all the instruments by donation. So we have not like the best instruments, but we received some donated instruments, and that's what they're utilizing, and he's fixing them and tuning them. So they have music once a week for 45 minutes, and the principal was able to get a fine arts credit for them.
That's great. Are they going to do any performances?
Well, we have a talent show at the end of the month, and I'm not sure if they're going to choose to play an instrument. They're selecting their own talent, so hoping that they will.
Very nice. Thank you. Any other questions or comments for Carmela? Thank you. Thank you, Carmela. Turquoise Lodge. Shauna?
So in the first quarter, with our adult program, we had 177 admissions. We had 181 discharges on our adult unit. For our adolescent program, we had 29 admissions and we had 28 discharges. When we look at demographics, we tend to service more males than we do females, which is pretty consistent every quarter. Going to the next page, there's a breakdown of the ethnicity demographics. For our inpatient admissions, the average age that we're servicing is between 21 and 60. The drugs that people tend to primarily use are opiates and alcohol. That's been pretty consistent for pretty much the whole time that I've been there. We are seeing a rise in methamphetamines being a secondary substance, but for the most part, we're servicing individuals that have opiate and alcohol addictions. The third page, I was reliant on my colors, so I can't really tell you what counties we're servicing.
I apologize for that. I forgot we got our printer fixed.
But I know that we service primarily Bernalillo County, Sandoval County, Valencia County, and Socorro. So those are the primary counties that we've been servicing for some time now. In our MO2 clinic, we are servicing in one quarter almost 2,000 consumers, which is almost 3 times the volume that we've serviced in our time frame, and that has a lot to do with the changes that we've made, enforcing that consumers are actually coming back for reevaluations in order to get their medications, and the daily dosing that we've been participating in for the last 6 months. When it comes to program improvements, in the last quarter, we have opted to really pay attention to our transitions at Turquoise Lodge. Our stays are really short, so we have 21-day stays for adults. Myself and our clinical director, Jackie West, actually interviewed over 100 consumers, and they actually helped us create a new transition ceremony, which is pretty significant when somebody leaves our facility. We used to have a program where people would come to our facility and participate in a transition ceremony, but this transition ceremony that we've actually put together was the feedback of the 100 consumers that we had, and 35 of those actually participate in our transition ceremonies every week. There's a breakdown of the process, but for the most part, it's much more focused. It's one time a week versus every day, which is what we used to do before. We actually have a script, so it's very structured in the sense that the participatory consumers actually have a lot more feedback in the process versus our staff running it. There's wishes, there's stones, there's a script that our staff actually reads. The consumers that are actually leaving write a poem and read it to the group. We have people who have been in our program come back for the transition ceremony, and then we actually present a gift to the person who's leaving. The feedback that we've gotten from the consumers is that this process has been very significant, and our consumer surveys actually have revealed the same information. We are making steps towards increasing our adult detox beds. Actually, today my maintenance crew is going to Silver City and picking up 10 medical detox beds. And by October 23rd, we will be increasing our adult detox beds by 50%. So we're going to go from 10 to 20.
Yeah, that's great.
Next week. We also, in this last quarter, myself and my clinical director and my director of clinical services got certified in the matrix model. So we are in the process of diversifying our program at Turquoise Lodge sometime in the early spring. We are looking at locations at this time, so we have a couple of different choices. As you guys know, we actually lease the buildings from the county, so we don't own it outright. So a couple of different options that we have is that we can actually do a renovation inside of the Motu Urgent Care. And two other options would be that we would actually purchase a portable building ourselves, or the county would do so and they would fold that into our lease agreement. So at this point, we're trying to find the most appropriate space for IOP, and we're hoping to start that up in the fall. In the last quarter, I have hired some pretty key positions for our facility. Turquoise Lodge hasn't had their own pharmacist in over 20 years, so we actually hired a pharmacist supervisor
Excellent.
for our facility. She's not only a pharmacist, but she's also a clinical prescriber,
Pharmacist
clinician. So she can actually see patients and act in the pharmacy role in our facility. I hired our director of nursing, who is actually part of your OFM team, Dave McCullough. He started in the last month. Hired a finance director internally, Alfred Cerna, who's been a great resource for our program. And one of the big positions for us is that I hired the director of clinical services, which is the person who now is the supervisor of both of the rehab programs and is actually going to be the facilitator of IOP. At this point, we have 22 vacancies, and we are diligently trying to hire. The last time we met, I talked about the art project that our adolescent program had participated in, and they actually picked their art to highlight anti-pollution in New Mexico. So I wanted to pass them around.
Shall I describe how big this thing is and how it was made?
It's about 7 feet tall. It's 5 feet wide and 7 feet tall. It's at the Botanical Gardens. It's really, really beautiful, and it's all made out of recyclable stuff.
Bottles, bottle caps.
Bottle caps, different types of plastic tarp.
Yeah, it's beautiful.
It's really
It's absolutely beautiful.
And that's all I have.
Shauna, can you give us just a brief overview of how the matrix model, how is it different from other IOP models?
The matrix model is actually very unique in the sense that it's not very reliant on the consumer actually working through their therapeutic issues. It's really changing the way the brain works, and it's helping that person look more towards being able to problem solve, be able to communicate more appropriately. And so it really kind of bypasses somebody's trauma issues, family issues, past related issues, and it gets that person to a point where they have to really focus on the here and now so that they can be productive and move forward. You can utilize the ancillary services like individual and family therapy as an adjunct support system, but it's really 13 weeks of preparing that person for life. So it's a very real model. It's been very successful. It's actually known all over the world. People use it all over the place. And it has a really, really good success rate in the sense of getting people to a place of sobriety. And it also embraces people that relapse. So it's a model that acknowledges that somebody's going to have to go through perhaps treatment a couple of different times. And it's a system that's going to support that person regardless of what they present with. So it's not an abandoning model in the sense that, you know, you've relapsed, now you can't participate.
Right.
It really embraces the consumer when they do.
So it's really focused on recovery, not the failure of treatment.
Well, I think the path of recovery, because recovery is really, it's a journey. It's not necessarily something that just happens and then you are well and your life is great. So it embraces that person, but it also, I think, keeps them focused on the end result versus them getting caught up in their trauma or their family-related issues that might have facilitated the problems.
Excellent.
Any questions or comments for Shauna?
One comment, we're about to embark upon a renovation project at Turquoise Lodge. Bernalillo County is going to be replacing HVAC systems.
Yes.
And that's going to cause us to have to modify our life safety code. We've got a call in this morning, actually. I mean, this is hot off the press with DHI. We have to submit plans to DHI for their approval. I've already notified Max Roy. He's on it. Hopefully after our meeting today, we can have some more logistics discussions on how that's going to happen. But the project's going to take 90 days, and it's going to involve splitting the quarters in half so that we'll use half the quarter for patient care. The other half of the quarter will be renovated, and they'll do 2 floors at a time. So when you get around to it all, it's 90 days of life safety code issues. But we're going to be working with that, and I think that's probably going to go smoothly. The timeline's a little short, but I think DHI will work with us to make sure we meet our timelines. We've been asking Bernalillo County to do this, and now they just kind of say, okay, we're ready to start. You know, so it's kind of a surprise. So that's what's happening there.
Any other questions or comments for Shauna? Thank you, Shauna. And congratulations on doubling the CD unit is going
Detox.
from 10 to 20. And when is that opening?
The 23rd, next week.
That's big. That's big. That's a wonderful advancement. Los Lunas Community Program, John.
Thank you, Madam Secretary. Los Lunas, our census basically stable at about that 78 number. We continue on moratorium other than crisis situations that we assess individually on our ability to staff and our ability to house. So our numbers are staying pretty consistent there with the 78. We did undergo a internal Medicaid audit that was conducted the tail end of last month, completed as of September 30. I think the audit identified basically 4 findings, 5 observations. None were identified as significant. Our plan of correction was accepted as of October 2nd related to that. Aquatic Center continues to be a high priority both within Valencia County itself, but also within Department of Health. Michael Brown and his group continue to work with us on that. We have got the bids related to the filter systems and other items that need to be repaired that we're pulling together, waiting for just final quotes with that so we can move forward. But we do have some agreement that how those costs will be handled. So.
And we're working with GSD on that, correct? We're working with GSD on that, correct?
Mostly with Sherry out of those offices there, but we do have their commitment at present time. So that's moving forward. Dental clinic presentation, we had submitted that for review and hopefully approval on the clinic just to Legislative Finance Committee and some of our funding bodies to be able to identify exactly what that clinic is involved with, number of consumers that are served, and that it is also a statewide crisis situation related to dental services. So that packet, Dr. Grady and Dr. Lyons pulled together, I think reads very well, shows very well, and should be beneficial as we move forward with LSC hearings there. We also are working with DDSD, Developmental Disability Supports Division, related to ICF, Intermediate Care Facility expansion. Those are related to 4-bed residential situations that we are looking at. Right now, we're on about a 36-month window, basically, related to those facilities. But that is in process. First meeting is actually was scheduled for last week. So that is ongoing. We continue to catalog and secure old Jackson materials that are presently stored on the old Los Lunas Training Center campus. We have a couple people, staff members assigned to that. We're attempting to get that cataloged. It's a huge volume, but we are working on that. The quarterly newsletter for Los Lunas has been completed and is being distributed by our cultural competency staff. This is really, at least in my tenure, our first formal newsletter to be distributed. We did have a consumer and staff picnic that was held in Berlin in late August for any and all folks associated with Los Lunas Community Program, including general public, and that was well received. We were happy to do that. Our overtime costs are coming down a bit. Not to the levels that we are looking to get to for the remainder of the year, but we have had a decrease from previous FY year. Jackson Community Practice Review is presently in process with us. This audit involves, this time around, it's one of 2 reviews that are done annually related to the Jackson litigation. This involved 12 of our consumers this time around. We have not had the outcomes yet. We continue to work with DDSD to attempt to develop potential funding streams related to these crisis referrals and our 1.6 referrals that are not actually in our ICF program. So we continue to look at options there. That is a heavy financial burden, so anything we can do there related to Los Lunas, impact-wise, finance would be a real plus. So we're looking at that. We presently still have 28 total residences under lease. There were some changes in home locations within the county, but not the total number of properties that we lease. And we also had Channel 13 news media out in August related to vacant state properties. Los Lunas Training Center campus was one of the vacant state properties that they did do some film work on. The personnel-wise, all our key positions are filled at present. Staff vacancy rate when this report was developed was right at approximately 8%. We had 4 new employee orientation sessions held over the quarter. Those are 2-week sessions each. Total of 17 new employees participated in those sessions, and that is the number of new employees for the 4 through 17. And that is basically, Madam Secretary, my report, unless there are questions for me.
Thank you, John. John, how many 1.6 referrals do you have right now?
Right now, presently we have 4 in our ICF formal program and 4 outside of the ICF, so a total of basically 8.
May I ask a question about the dental program?
Yes.
So you said that LLC was looking at the program.
What I think the intention is, the Department of Health wanted to make more of an emphasis related to the financial need of the dental clinic and its services, so that the presentation was developed more to inform legislators of exactly what is occurring in the clinic, also exactly where we stood financially related to that, and to attempt to identify a dollar or financial level of support possibly coming out of legislative session or the next session or two specific to the dental clinic. Right now, Medicaid payments cover about 40% of the cost of the clinic itself.
So you're looking for 60% funding?
55 and 60 sustainable, and that turns over to about $500,000 per year.
And the need is, you know, also, I mean, it's not, that's with present volume, but we recognize that there's a, from a feasibility standpoint, that there's a greater need throughout the entire state. And Dr. Lyons and Dr. Grady are specialists in this, and they're trying to grow that, because once their expertise and skills goes on, who replaces it? Because then these special needs are there all over throughout the state.
Thank you.
Any other questions or comments for John? Thank you, John. New Mexico State Veterans Home, Janet.
Thank you, Madam Secretary. Our resident average census for the preceding quarter has been 121 for our nursing home and 6 for our domiciliary unit. As you can see in our report, the average census has been steadily increasing. We are conducting admissions team meetings Monday through Friday, where the different disciplines review the applications for admissions. And our acting admissions coordinator is staying in constant contact with area hospitals, rehab facilities, etc. And she's expeditiously collecting any information that is identified in the admissions team meeting, and then bringing that information back to the team so that we can get admissions in as quickly as possible. And I'm happy to report that currently our resident census has been staying between 129 and 130 residents. Today, the census is 129, but we have 2 admissions scheduled for this next week. As far as projects and constructions, on July 21st, we were ecstatic to finally have our groundbreaking ceremony for the construction of our new Alzheimer's and Skills building. The residents and staff would like to really thank all of you that had a chance to come to our groundbreaking, as well as those of you who sent their best wishes. Construction of the new building started the first week of September by putting up fences around the construction area to help ensure the safety of our residents, staff, visitors, and public. The construction company is moving a lot of dirt around, and the site is starting to look quite different. Many of our residents are thoroughly enjoying watching the heavy machinery and the day-to-day construction that is taking place. And we've even had one resident that tried to get a job over there with the construction company. But the construction company has been very good with the safety aspect, making sure that things are locked and guarded. We had our bridge retaining wall between the main building and staff development is closed off right now, and they've been very good about keeping that closed. And when they've been working on it, they've had somebody manned there to watch to make sure nobody gets through. So they've been very good. Personnel, we've had 9 successful hires in July, 10 successful hires in August, and 4 successful hires in September. Newspaper ads, emails, phone contacts with educational institutions, housing authorities, etc., along with job fairs are all part of our recruitment activities. The application process is, as we all know, often cumbersome and daunting for some applicants. So we have 2 computers dedicated for our human resource staff to assist applicants. And then in addition, we have many applicants who call on the phone while they're applying from home to get assistance. In August, we hired a new director of nursing. She's a local person with many years of experience in the local hospital and nursing home, and we feel very fortunate to have her as part of our team. She's working well with everyone. She's got a positive attitude and a go-getting attitude. And because she's worked with so many other nurses in the community, we're starting to see and reap the benefits of that. We're hiring one person that she worked with over the hospital, an RN, actually two. We have one that we haven't gotten through the hiring process yet, but I'm sure there won't be any issues with that. We also in August hired a new EOC Risk Management Safety Director, who's been a great addition to our facility. And then in September, we hired Tilla Polani, who is a social worker. Nurses continue to be hard to recruit for in this community because we have so much competition with the local nursing homes, the hospital, as well as home health agencies, and we are a rural community. We have our administrator position open, but and vacant, but OFM has begun the interview process, so we're hoping that we will hear something on that soon. Our staff continue to work on all the survey issues and report to the quality assurance performance improvement, their reports and audits for all follow-up. The windows for the upcoming surveys are CMS survey. Our window is anywhere from January 15th, 2016 through August of 15, 2016. For the VA, our window is August 2016, and Joint Commission window is July to September of 2016. We're awaiting our influenza vaccines, and our infection control nurse has been gearing up, getting ready to begin the vaccination of resident staff as soon as we receive those vaccines. In your packet, we have a human resource data sheet for you, which shows our successful hires, vacancies, turnover rates. I won't read those all to you. In our miscellaneous actions, family medical leave, and workers' compensation actions. Then also in your packet, we have an FY15 summary of major PI activities. Those activities include pain management, medication error reduction, fall reduction, injury prevention, priority focused skin, employee flu vaccination compliance, employee Hep B vaccination, mock actual codes, and hand hygiene. And I'm glad to say last year we had a target goal for the employee flu vaccination compliance of 90%, and we achieved 96%. We hope to do as well or better this year. Pain management is ongoing, and we strive to improve interventions for the pain management, and that is taken to the priority focus team meetings and looked at on daily rounds by our medical team. Falls reduction, that has been restructured for a more immediate proactive response to resident falls. There's a formal team that meets and is actively involved in the program, the Falls Program Virtual Breakthrough, which is a state veterans home initiative. And they're just getting started in that, and they've had a couple of meetings. And so we hope to see a reduction in falls. Our priority focus skin, that is an ongoing committee that meets weekly to review all the skin issues in our facility. And our target for that is 0, stage 3, and 4, and developed after admission. And I already discussed the flu vaccine, the Hep B vaccine. There's no target is identified for that, but just to get education and to employ employees on the Hep B and offer them that vaccine. Mocked an actual codes. Actually, while I was sitting in our meeting, we participated in the earthquake drill, and our staff development and our risk management safety EOC department work hand in hand on these codes and drills, all hours of the day and night. And the education is provided immediately during those drills, so everyone is aware of any issues that came up. We usually have a debriefing afterwards. We have people that are stationed throughout the facility to identify any issues that we can see that arise during those drills. And of course, hand hygiene is an ongoing activity that is both monitored and education is provided by staff development and our infection control. Also in your packet is a narrative of the FY15 Performance Improvement Summary. And during this year, we've had enhanced monitoring of issues identified by facility administration, facility staff, and regulatory agencies. And all regulatory requirements are being reported and as required. The CASPER reports were the basis for many of our performance opportunities being examined. As a facility, we continue to maintain a population that is considerably older and frailer than the state and national comparison group. And our gender distribution is also significantly different than the state and national comparison groups, with our male population exceeding the norm by more than 30%. There were 5 Sentinel events that were reported to Joint Commission, with the root cause analysis processes were completed on all, submitted to Joint Commission, and all the measures were successful. Measures of success were completed, submitted, and accepted by the Joint Commission. Ongoing performance assessment activities include, but are not limited to, environment of care, a safety risk assessment, fall risk assessment, post-fall investigations, medication administration observations, management of pain, skin integrity, nutritional at-risk resident assessment, behavior and mood assessment, infection control surveillance, incident management investigations, and hand hygiene. So we're looking forward to the future and all the opportunities we have to be creative with our resources and our skills, and we're committed to providing great care to our residents.
Thank you, Jan, and congratulations on your excellent employee flu vaccine compliance. 96% is outstanding.
Thank you.
That's
Excellent.
Really, really outstanding. Any questions or comments for Janet?
One of the additional opportunities down there, we're working with the VA to transfer their Tanberg unit down to the Veterans Home so that they can do the consultation for behavioral health services. The agreement's been signed. We're still working with the logistics of how to get the equipment on site with the VA, but that should happen pretty quickly, so that's progressing rapidly.
And can I say thank you for all your work on that, Dr. Dorman? We're really excited about that.
You're welcome. Thank you.
In the area of fall reduction and injury prevention, I'm just curious why there is not a target goal. It's just reduction in falls. Have we identified a percentage reduction that?
Well, the idea is always to go to 0.
Right.
And right now, I think they're averaging about 1 a day. And so the target goal is to actually go to 0.
Okay. I'd like us to identify that as
Sure.
the goal then, not just reduction. Any other questions or comments? Thank you, Janet.
Thank you.
New Mexico Rehab Center, Brad.
All right, well, thanks again, everybody, for being here. I think a lot of you have been here, but we are going to do a tour after the meeting with the lunch coming in. So it's a small facility. It's about 5 years old, if you haven't been here. And the old facility was demolished. People still go there all the time, you know, on the GPS thing. That's where everybody goes. We're kitty corner here with Jeff and his public health team, and Mark's right. We probably want to be looking for synergies and opportunities there. So we're next door neighbors. We're small in the sense when you do a tour, one of the first areas you'll see here, we have PT, OT, and speech here, and we have a pool. Can't use it, but we have a pool, and we have a gym, and it's really nice. It's a really beautiful setup there.
We're happy to take over the pool if you don't.
Yeah, you can go for it. You know. Dr. Dorman was suggesting $10 per person.
There you go.
Aerobic therapy, aquatic therapy is something we need to bring.
And after that, you'll see what we call it. They call it the chemical dependency unit. It's not medical detox. We don't have that yet, but we've got 24 beds there. And just in the last month or so, because we're working very closely with the adult probation and parole people in town here, when they're fully staffed, they got about 9 or 10 of them. They really have trouble hiring anybody because it's such a terrible job. We have a meth epidemic here, really do. We had 41 people busted here a couple of weeks ago. So most of the patients you'll see in the CDU side are meth. But that's grown very rapidly. So at one point we had 28 there. We were using the medical detox beds a couple of weeks ago, but we're around 2021 right now. So I think that's going to stay full. What we're hoping to do, and we've worked with Turquoise on that, we're going to, in the southeastern part of the state, we've had 4 medical detox beds when the building was built, never used them. Hopefully around November 2nd, for the first time ever down in this part of the state, we're going to launch medical detox. We're working closely on just finishing up some of the remaining questions on that. So when we open that, there'll be 4 beds for medical detox, and it'll kind of give us a continuum of care. Some of the things we were talking about earlier this morning with Dr. Dorman. So patients with Dr. Black, he's a combination, he's a psychiatrist and internal medicine physician, great doctor. And he has opportunities then to put somebody in medical detox, and perhaps they'll move into the CDU, perhaps they'll move into our new ILP, and I'll talk about that in a second. And the medical rehab unit, that's competitive with the private sector. You know, so we covered everywhere. They've gone to Lubbock, Midland, Odessa, El Paso, Las Cruces, everywhere. And so we try to get people in there. That census is always a little bit lower. Usually it's 3, 4, or 5. So what we decided to do when the Arizona provider, Turquoise Health and Wellness, pulled out of here March 31, and then subsequently the La Frontera pulled out of Las Cruces, there's an opportunity for what we call this intensive outpatient program that Shauna described much better than I could. But it's an opportunity. It doesn't fill the big vacuum, but it's outpatient, 3 hours a day or evening, 3 times a week, 16-week program. We didn't have a lot of experience or any experience in that, so it's been a lot of trial and error. So we're going through that. Jose and Patrick Tellerico and Lisa, a lot of people have been helping us with that. A lot of trial and error, and we've had to, we started in the middle of May. We're doing evenings. We just hired another guy that came on board this week with Matrix training. We did a Matrix class here, and Fort Bayard came over and Turquoise, some of the OFM team. We had a Matrix trainer come in and get people Matrix certified. So that's really been great. So in the IOP program, right now we got a universe of about 14 people in the evening one. They don't always show up. That's the biggest challenge you'll see with IOP. We call them every day. It's really hard to get these people in. Most of them, again, are meth. And so we've got a little starting list for the second IOP that would be in the afternoons. But I think when we have an opportunity, probably Jeremy, to sit down with you guys in Fort Bayard, we've worked out all the billing kinks, I think. We had a lot of documentation issues. September was really good for billing and documentation. We've got new policies. We've got a handbook. We've got just all types of stuff we've had to put together. I think will help Fort Bayard. So that's a big growth area for us right here. We've got there are a few vacancies. We're kind of lucky. If we had every position filled here, we'd have, I think, 93 people. We've got about 7 vacancies right now. We've just been lucky here. We've got 2 local hospitals, and things aren't going so well at either hospital. So we've been rapidly stealing their people. We're getting a lot of CCU nurses, labor and delivery nurses, PACU nurses, ER nurses, techs, and everything. So we've only got 2 RN openings, no tech openings, 1 counselor opening, a couple cooks. So we've just been lucky in that regard. The idea is to try to retain them now, just do a better job of orientation and retention and mentoring. And we have a new DON also, Patricia Welker, was in critical care up at Eastern, and she's an Army nurse. Believe it or not, she was in Saudi Arabia for a year. That was a story for her, that was fun, I'm sure, for her. And she's great. She's been part of that, I think at Veterans Home, having a really strong DON helps. Yesterday, I guess we should have done it today, but we were doing flu shots all day yesterday here and last night. And then we got, 53 out of the 83, 84 people we have, so a good start on that. And probably after I'm done, I'll have you comment on that, Dr. Norman, about the masks and that sort of stuff in a minute. But we were talking this morning about, would definitely be beneficial here and probably to your other facilities. I'm real interested in the VA partnership with Tri-West. If we have a contract with Tri-West, at least here we can have a veterans IOP, we can have more veterans in our therapy area, we can have more veterans in all our areas. So I'm really interested in that, and Kim's working on getting in network. Believe it or not, we're not in network for Blue Cross Blue Shield here. So we're just working on some issues like that. Kim's taking that one on. We thought Joint Commission was coming in right now, today, about any moment now. It would have been embarrassing to come in today, but after you start an IOP, it's like a 4-month clock starts ticking. Same thing with medical detox. But I guess fortunately they made a boo-boo, and we're not really, the clock didn't start ticking. So we maybe have more time, maybe another 4 months? Maybe. And then we could be nice, the ideal world, Dr. Dorman was saying they could come in and look at medical detox, which is hopefully going to kick off November 2nd, and also look at IOP. But when Fort Bayard, well, they're not Joint Commission, I'm sorry, they won't have to worry about that, or Turquoise, but with us we have to worry about that Joint Commission surveyor coming in, so we're not right away. But I think the big thing, the big change, and it's a revenue option, it's not a revenue producer for all of us, for Turquoise, Fort Bayard, and here is the IOP. It has been a struggle. I think we've mastered it now. And we had a lot of help. Big kudos to Jose and to Patrick Tellerico and Lisa. A lot of people came in here and spent a lot of time here working with us on that. And we've had a lot of meetings with the counselors. We've had ASAM training, American Association of Addictive Medicine training. So we've been certified in that for the medical detox. I was wondering where we'd find somebody to do that. It turns out right next door, there's a certified instructor, 100 yards away. We didn't know that. So I think we're ready for that. So a lot of things happening here right now, but I think that's it. I think Dr. Norman, I was going to ask you to comment, I guess, on the mask. You said we could do the Zorro masks, so we're going to do those.
It's the season.
New Orleans Mardi Gras masks.
Halloween's coming up.
We had our flu shot clinic last night, and all the facilities are dealing with when do we actually start the requirement to wear masks if unvaccinated. And obviously, it wouldn't be fair if that started before they had the opportunity to have their institutional flu shots. So we had it here last night. They're going to be following up with some of the remaining employees, and so the local facility here has set November the 1st as the date to either show evidence of having gotten the flu shot, which is evidenced by a little sticker on the name tag here, and I got mine last night, even though I got my flu shot a while back at the Runnels building. But November the 1st is going to be our day, and I think NMDHI has also set a date. Has Connie set a date up there, Troy? Do you know?
For the flu shots?
When they'll start requiring the wearing of the mask.
We're going to know when DOH does it. You guys say 11/1.
11/1.
I thought you established.
Okay, so November
It's
the
supposed to be
1st.
the first day when the first flu case is identified, but then no one had opportunities for
Right,
flu
it
vaccine.
started awfully early this year. Fortunately, it hasn't become pandemic yet. It's still localized to just a few cases in New Mexico, so I think we've got just a little bit of time, but everybody's moving aggressively toward that, so I really appreciate that, and that's to the credit of everyone who's really devoted a lot of effort into getting that done. The second thing with the Joint Commission, Brad's right, we submitted our change in service on our application, but it never made it through the notification process, so Joint Commission actually never knew that. So I contacted our account representative. I said, are we going to get an extension survey, or is our census low enough that we won't require one? Of course, the answer was, we didn't know you had additional services, but they went back and verified that we had reported it on time, and that was very good. And so today, I just sent our account representative another email saying, oh, by the way, November 2nd, we're gonna open up 4 detox beds. You might wanna consider this when planning an extension survey. So I think we're gonna buy another 4 months, I hope. So I'm confident that with the documentation the way it is now, if they came in today, I think we would be in really good shape. They do a kind of a limited look back with a new service,
Right.
but we've just gotta maintain that gain until they get here. And of course, we need to be ready anytime because they can walk through the door with a full survey team tomorrow if they really wanted to. So we're gonna be ready, but I think that's gonna be a really successful extension survey.
Thank you, Steve. Any other questions or comments for Brad? Mark?
Other area of potential cooperation, I mean, we have our regional director here who's based in Roswell. We have a big operation here.
Right.
I don't want to hijack the meeting.
No, it's a great question. I think, are we still today at 2 o'clock? We might do a combined management meeting. I forgot that. Is that still on at 2 o'clock?
it's still on.
Okay. I guess we'll have to squeeze in here, but we'll do that pretty good. Okay. Yeah, I'm open to any ideas. Maybe at 2 o'clock today when we're talking as a combined group, there'll be some better opportunities to do that. You know, even though we're right next door to each other, you know, there hasn't been a lot of that. I know I was over there with you recently, but yeah, what would you suggest? Do you have any suggestions? You know, we could talk about those.
Pool is an obvious area of cooperation to begin with.
And I think even listening to everybody speaking, talking about, for instance, the drills, the codes that are going on in the facilities. I heard the earthquake drill was done at one of the facilities. I don't remember which one.
Do those community drills.
And for us, for public health, we do that as well. We have Bureau of Health Emergency Management staff with public health that we have the information, we do the drills, and I think it's just an opportunity. If we're doing on silo, might as well combine with facilities and make sure that training and drills are conducted together.
So maybe you and Brad, now that Brad's sort of down here, could just touch bases once in a while and just explore where there might be synergies. Because we've got different sets of resources, they're all kind of co-located. It seems like there must be some stuff we could do. I mean, off the top of my head, I don't have a good answer.
I should like to use your conference room someday. Great.
Any other questions or comments? Thank you, Brad.
Sure.
And Kathleen Luttrell, Fort Bayard Medical Center.
Good morning. Okay, we done the last quarter. We have, our census has been, we try to keep it up at 145. Actually, we went down a little bit. We had some celestial discharges, which, you know, they wake me up in the middle of the night and tell me, and I'm like, Godspeed. And then I go, but can't really do that. That's the business that we're in. Today we're at 143, and I'm happy to announce that we have 3 pending for skilled that they're going to evaluate today, and also 3 for Unit C, which is our dementia unit, which I'm very excited that they're going to go look at some people for that. So we'll get that back up again. Our kitchen floor reconstruction was finished and was completed and is doing well. We've had some dish machine issues, but that is also now getting repaired, so thank goodness we can get rid of paper. We had an evacuation road built to Baton Park, which is right next to us. They built us a road. They put a gate in there.
They is in.
Yes, it is beautiful. We got
Grant
keys
County?
to everything. Yes, Grant County told us a few months ago, unfortunately, right at the end of the fiscal year, they said, we're going to build a road there. If you want one, give us the material, money for the material, and we'll build it. And we're like, okay, we got to find some money, and we did. So that is very exciting because that just gives us an opportunity to evacuate if we need to, and we were very excited about that, and I'm very appreciative to Grant County. Our point care is fully operational now, doing very well. Finance did some billing and some successful billing, I might add, and that just recently, so we're very excited. And all the departments are working towards doing that.
Kathleen, can you tell us just a little bit about what point click care is for people who may not know what
Sure,
that is?
it's a nursing home electronic
Health records.
medical records, you know, and you point, you click, and you care, okay? But it is it's nursing home friendly, which Avatar, is not so nursing home friendly. And so this, is part of what we do, and we will eventually have kiosks in the hall where a CNA can go in and put in her information of the care that she's done or he's done, and that will help us a lot in documentation. That we're really looking forward to that. And it's just very nursing home friendly. A lot of things that, in the 20 years I've been doing this business, a lot of things are not nursing home friendly, and we adapt and we make do with what we have. But this program is really, really nice.
Just to, if you don't mind, I'll just elaborate on that, on the point-click care. EHRs have a different focus, so acute care hospitals, long-term care, even behavioral health, they have slightly different vantage points that they look at things for a given client, patient, resident that you have. Point-click care specifically, we were fortunate to kind of stumble into it because a couple of years ago there was a product that we were using that needed to be changed over, and point-click care was the company that bought them out. Turns out that in the meantime, I think it's the National State Veterans Home Association has looked at a multitude of different type of EHRs, and point-click care kept coming up, and I believe it's kind of trending to be kind of the industry norm or standard, as well as the VA that we're currently working with, even though they have their own EHR, but for long-term care, they're very familiar with point-click care. And actually, of recent, we've been, as we devised the OFM team, and we're specifically looking at fiscal operation team members and the kind of the responsibilities we want them to have, looking at the industry for healthcare and with financial individuals, they actually built into some of these expectations that point-click care knowledge is what they would like to see from the billing aspect and capturing a number of the coding and stuff like that. So point-click care is a very good product for the long-term care segment of what we do.
Can I just add just another
Yes.
piece there? The other wonderful thing about point-click care is that it has assessments already built in, but you can build them specific to whatever it is that you need to document. Documentation is key, for billing, so you can also add on that as well.
It's fantastic.
Thank you. Thanks for that clarification.
We love it. Okay, the old Fort Baird Hospital, they have begun taking a lot of the things out that is for salvage, the company that's doing it. And so that's progressing, and they have the fence around. We had an interesting situation with some medical records, and we got a team together at Fort Baird, and also the OFM team, thank you very much, came down and helped us, and we managed to, get that out in a timely manner. So it was.
Team did a great job.
That was
a great team effort.
Team
It really
effort
was.
in a
Well,
very
for you
short
guys
period of
too.
time.
They were really. We have pictures of them in these little suits, so I can probably be coerced into getting them to you.
I've seen them.
Yeah, okay, good. We're still working our strategic plan, of course. We have, the groups have started to meet again to keep our momentum going. We took a little hiatus for a while after we got started, and then now we're beginning again to measure some different things in the area. We had on our personnel, we had 26 hires in the quarter, and we were happy to say that we're keep doing that. One of the successful things we have done is the CNA class. We hire for the CNA class, we get the CNA class going, we get some of them on the floor, we get them trained, and then we have another one going right away. That has helped us considerably. And I'm going to skip a little bit here because I want to talk about contract nursing, because that's part of the CNA issue. Our contract nursing costs for the first quarter of FY16 decreased by, drum roll please, 77% over the first quarter of
Excellent.
FY15.
Great.
That's outstanding.
Yes, we have, that has really been a big accomplishment. And right now, I think we have 3 contract nurses.
Mm-hmm.
And Esther keeps a little thing, and she says, okay, cross that one out, cross that one out.
How did you do it?
How did we do it?
Like ripping
Well,
off a Band-Aid.
Yes, being an administrator for 20 years, the only way that anybody gets out of contract is to stop contract for contract nursing. It's hard, it's difficult. In the private sector, it's like the 4-letter word in nursing homes is contract nursing. And they normally, you just get a ultimatum that says, well, you know, if you can't get rid of contract nursing, then we will get somebody who can, that sort of thing. Fortunately, the state doesn't act that way, but you cannot, there's a lot of reasons why you don't want contract nursing, because they come to leave, they do not come to stay.
Well,
And because of that, you have a lot of issues, and so we're happy that we're.
if I can kind of back up just in something that you stated with the change in the CNA class, and kudos to Esther and the team that did it. They revamped how they did the CNAs and how they trained them, and they oriented nurses. Now they do still, from my understanding, still have a few nurse contracts, but not the CNAs, which was a bulk of the nursing contracts that we have. What they did in allowing more frequency of bringing in individuals for those type of functions, and then train them in the way they trained them and broke it into phases, allowed them to offset the need that they had, that the contract nursing staff was vacating, and they actually addressed that need by doing this hybrid model that they created, which was so far has been very effective, and I applaud the effort and the original thought and innovation in doing that. So I really appreciate what you guys did.
One of the things that we had historically was that anybody that wanted to be a CNA would come and get a job at Fort Baird to become a CNA, and then they would leave. And I'm going to let you tell what you told me on the way here about the new thing that's happening. It's a very positive thing for us, I believe.
Well, recently we were the only facility in the area that offered CNA programs. The two local facilities were unable to do classes due to survey findings. And they reached out to me, and we started looking at a way to kind of partner with them. Basically, for me, it was more of a selfish reason, because I did not want people to come to leave. I wanted people to come to stay. So we started talking to Western New Mexico University and just kind of collaborating, brainstorming, and successfully the local nursing home, Western New Mexico University, and Workforce Solutions partnered up and are going to be offering CNA classes in our areas, which is wonderful because, again, it allows the community members to get the care that they deserve, and then I don't have to worry about someone coming in to pretend like they're going to work for me and then just leave after certification. So that was a good start, and I'm very glad to see this happening, not just for me, but for the community as well. So
that was one of the benefits of when we revamped the program, when she revamped the program, was to get people on the floor. Because if they just came in to get certified, then they were like, what do you mean I can't do it right away? You know, so we made it a longer process, and we lost a couple right away, and we're like, okay, that worked. And so that saved us some money because they weren't just, you know, taking advantage of what we were giving them. But so that, I was excited to hear that. I think that's a very positive thing.
That's a great model that you've come up with. So congratulations on developing and implementing that, and extending the partnerships that are going to create even greater capacity there.
That's because I have the DON in my dreams. Used to have finance in my dreams. So I will keep the DON in my dreams. So just bear that in mind. But
Thank you.
Anyway, we where am I? Okay, survey regulations. We have passed all our surveys, and we're just waiting for Joint Commission accreditation, which I believe is like August or something that. We're thinking that.
No, it's gonna be earlier than that. We're planning to have.
Does Millage know?
If we can get, once we get the paperwork done.
He does.
A mock survey. And we want the mock survey to be fairly close to the survey date, so we maintain our game during that period, but yet give us enough time to identify our opportunities to improve and actually do that. So Millage and I are gonna be talking about hard dates based on when we can get the mock survey done. We've selected a vendor for the mock surveys, which is considerably, probably about half as expensive as it was the last time we had these, so it's a huge savings. We're going to get probably the same consultants to do those mock surveys. The advantage is, and this was going to come, I might as well just discuss it now, the individual we're getting for Sequoia is a national expert on adolescent treatment.
Wonderful.
He is from Vermont, and that was the reason we selected that vendor. His name is Tom Zestoni, and he's nationally renowned. So that's going to be a huge plus for us. So that's really exciting. We hope to get him accredited no later than next summer.
Good deal. Okay. Our Yucca Lodge program is, it continues to keep about 10 to 12 people in their program all the time. She had a waiting list, but just like every waiting list, if it's too long, people start, drifting away. But they'll come back. They always do. And so in any case, we are trying to get our IOP. We have not got approved yet, but we have our application in and everything. We're just waiting. We did get a contract from the drug court for MRT to hold one program or one group each week.
Can you explain MRT just a little
It's
bit?
okay. I hope somebody else knows what that's. Moral
recognition.
Thank you. I was like, I knew you were going to say that. I knew you were going to ask me that. I'm like, okay.
Moral what?
Moral recognition therapy.
Yeah.
Cognitive
Huh.
treatment.
It's hard to say. That's but it's a pretty good program, and we finally identified a place in the facility to hold it, and that was getting kind of hairy because we didn't know if we were going to take away therapy's gym, and they were like looking at us sideways, and I'm like, oh well, but we did manage to find a place that we didn't have to take anything away. So we're doing that. We have we got a contract with them to hold 10 slots. So there may be 4, there may be 6, or maybe up to 10. But we did get that, and that was pretty cool. It wasn't a lot of money, but it was something. And that started 2 weeks ago because last Monday was a holiday.
This was an RFP awarded by the court system
Yes.
there?
Yes.
Kathleen, what is NCNS?
Where do you see that?
The third bullet under average daily census. It says 1 went to prison, 4 NCNS.
Oh, this is the, oh yeah, okay. Where am I looking? Oh, that's probably what it is.
Probably no call.
Yeah, no call, no show.
Oh, okay. Got
Thank you.
CDU lingo.
Yeah, I learned some CDU language, I went with her to probation, and they were talking about, the director, she says, well, I'm not one of those thug huggers, and I'm like, okay, that's new. And then she says, and this person will, I guess you violated them. Well, that's not what I thought violation meant, but it means that when your probation is violated. So, I've been going and learning a lot of new things that don't have anything to do with long-term care. But basically, that's where we're at in the program. We hope the IOP gets going. We do have a waiting list for that, and we're holding our breath because if they don't get plugged in somewhere, they end up, the judge says, go somewhere else. So we're really anxious to get that going.
Thank you, Kathleen. Are there questions or comments for Kathleen? Marie?
I'm just wondering how long the program was for CNAs and how long it is now.
The program is a 4-week program, and what we're doing is, because of the hiring process, that is where we see most of our challenges, because when somebody applies this month, it might take a while to get on the list, go through the application process, so we lose a lot of applicants. So what we did is, once we pull the list, we start doing interviews, and we train them as dining assistants and monitors, so that they can get some experience on the floor. Because a lot of times, people are just looking for jobs, and it might not be right for them. So it allows them to get on the floor, get the experience, and see if this is really something they want to do. Or they're coming just to use us, and they don't want to wait. So it's about, I would say, 6 to 8 weeks now. The actual program hasn't changed. It's just the process and how we do it, so that we don't lose applicants, and also to allow them to gain that experience and see if this is really what they want to do. Because in the past, they would go through the entire class, get on the floor, come into my office and say, I cannot do this. And so, it does a couple of different things, but the basis, the CNA program remained the same. It's just the process and how we do it.
Well, also,
You're
it seems to
welcome.
affect your long-term retention rate,
Correct.
which is better.
I just want to say that change you made is huge, and then partnering with the community is a huge success belief, because we've trained so many
of the
and just
communities.
turn them over every 6 weeks, having a class of
Absolutely.
10 if we're lucky, a few end up staying, and then, we just keep repeating it, so that is so much money we waste.
Yeah.
But not by any fault of your own, so that's huge.
Well, and this is the first time, for a while that our CNA vacancy rate is less than any other department. So it's a big deal.
It's incredible.
Yeah, so it's great.
It's traditionally the highest
Yeah, it's not anymore.
in any
That's
the
great.
whole industry.
Congratulations. That's a wonderful achievement.
I have to give kudos to Esther, because if she can't, she'll have an idea and we'll do it, and if it doesn't work, well, we'll just do another idea. And so I don't think that she really knew that it was going to be as successful as it was, but it turned out in a lot of ways, and we're like, oh, hey, we did something here. So, very proud
That's
of her.
how great discoveries are made. Good for you. Good for you. Any other questions or comments for Kathleen or Esther? All right, Program Area 6 Financial Report. Kim?
Okay, I'm gonna report for Leonard today, and I don't know if I will be in the future or not, but he's gonna be here, so I'll do this report. And this is the snapshot for the first quarter as we're reporting, and I'm happy to say that things are different now today than this picture, which doesn't look pretty at all. A deficit of 4.4 million, and we actually started the year with a bigger deficit, but as we're looking into things a little more, looking for different opportunities, it's slowly improving. So what we have requested is a $2 million supplement, and of course we won't know if we will be awarded that or not until 2016, the first quarter of the year. So our plan is to just assume the worst, that we're not going to get it. I mean, we really do need it, but we have to plan to hit our budget and to be at break even. So we have been teaming up with the facilities and with different initiatives around revenues and decreasing expenses so that we can meet that target. We have specific goals per facility. They're stretch goals. We know that we have been working on this for the past year plus because of our change in the general fund, which continues to go down. And these changes we're making don't happen overnight, so we're kind of working on things just as we did last year and digging in deeper and finding more opportunities. And what we're doing as far as looking for more revenues, we're collaborating with the VA and working on agreements with them to serve more veterans and being paid for those services. We are looking at maximizing our provider billings for the services they provide, making sure that we're capturing everything we can there. And of course, changes where we're going to be doing more billing is going to require an investment in more of our financial staff. Not a big investment, but if we're going to bring the money in, we have to be more like the corporate world and make sure we are staffed right to bring the revenue in. So we're looking at that. We're also looking into developing commercial contracts with various insurance providers and looking at the 4 NCOs we have for Centennial Care, making sure we're billing for what we should be there. We know we have to turn some people, we don't turn them away. They elect to go elsewhere because we are not in network for commercial services. So we are meeting with the insurance companies to do commercial contracts. And we know that's a huge revenue boost for us. It just takes a while to get it done, but they're in process now. We're also challenging the current contracts we have with companies so that we know that if they're submitting denials, and we know they're in the business to submit denials, that we're challenging that we're doing our documentation right, that the billing codes are right, and that they're actually paying what they should be. Seeing Mark across the room, we are coordinating with public health. Dan Burke was meeting with us with Presbyterian yesterday, and then we talked to Kathy Rock. So as we do all of these contracts, we're doing them all with you, and learning things from you and the other way around. So
good. Yeah, it makes total sense that we'd be doing that, and we're doing a lot of the same stuff you're doing. So I don't know, maybe we should have a financial meeting between PhD and facilities on a regular schedule to just formalize it.
That'd be great. Well, we're also collaborating with you guys with the pharmacy systems upgrade because there's similar cross functionality there that we're also doing. So your team has been participating with the OFM team and ASD on doing that as well.
We're also implementing some new services, as you've heard about today, with the IOPs and detox and more recreation therapy. And we've done a little bit of that. We've got more coming through the year, some starting the start of next year. We want to do them all right, so we're not crashing every one of the facilities. So, well, you know, with IOP here, it's been a lot of struggles, but we'll learn from that.
Right.
Our other two facilities. So, we're also collaborating with other agencies like HSD and Myers Colfax. We visited them, learned some things there. So we're trying to expand our knowledge and get ideas from people and share. As far as expenses, we're working on the pharmacy and reducing expenses there, trying to make sure we're right staffed everywhere. And inventory management is one of the initiatives we have also, so that we know we've got the right supplies on hand, that we just manage the system. Right now, we don't have a good system in place. So the 4.4 million is not our current deficit. It's more between 2 million and 0, which we're figuring out more every day.
Right. The one thing that and just to kind of elaborate, and Kim did a little better job than I will as far as articulating some of the specific strategies, but all of these strategies have been implemented or are actually currently being worked on to be implemented. And so the 2 million, even though that this projects the 4.4, will actually be 2 million less, as Kim said, as for certain for fiscal year end.
What portion of it is revenue enhancement versus cost reduction?
I don't have that separation here right now, and we have more of the revenue mostly identified, but we're working on it every day. In fact, we have a conference call tomorrow with our facilities to see what more we've nailed down since we met with them last week, and we'll do the same next week. So it's kind of a moving number.
Well, one of the
I wish I knew what it was in black and white. But.
Yeah, that would be useful to know because it's a really different strategy in terms of how the one works versus the other.
So there's two components to that. You're absolutely right, Mark. With expense reduction, it's finite. I mean, you know what you're dealing with. You know exactly what you would be cutting. Revenue enhancement, one of the things that go into that is the number of treatments or encounters that you have practitioners and other areas as far as based on those codes of billing and stuff like that, that you're able to generate the additional revenue. So right now we're working with the MCOs to make sure that we're on the same page on what we can bill for and who should be billing for those different areas. Once we get that finalized, we'll have a better finite projection as far as the revenue enhancement piece.
Good job. I mean, this is a tough area, and you guys have made tremendous progress, I think, last year. I guess it's 100% Kim, not you, Jen.
Yeah, that's right. She was the oracle.
It's actually started 2 or 3 years ago, so it's really a work in progress.
I know, I'm just joking.
Yeah, I know you are, but I do want to say that historically we talk so much, and this sounds biased because I'm an accountant, but we focus on what kind of clinical staff we need and what we need for the quality of care, and we don't focus on what we need in the administrative side to make sure that we get all the revenue in, that we have these things in place, and that's something we need to take a look at.
Yes.
I mean, we see exactly the same thing, which is, it's understandable why we would get like that, because we're all about, health and clinical care and population health. But all of the brass ring issues are all the back office stuff. So PhD is the same way.
And
So
we
it's
have
good that you're
great
focused.
staff that provide all the services in all the facilities. And they do a great job, they work hard, and we need to make sure that
This will be a team success.
Congratulations to everybody, because that's
It
a
is
tough issue.
big.
The facilities have struggled with it for a long time.
we're excited about it.
It is very exciting.
It is exciting. It's exhausting.
It's fruits of your labor.
Amen.
Questions or comments for Kim? Thank you. I need a motion to accept all of the facilities reports and the financial report.
This is Steve Dorman, I'll make the recommendation.
Need a second?
Roy Jones on second.
We've had a motion and a second to accept the facilities reports and the financial report. All in favor say aye.
Aye.
Opposed? Reports are accepted. Thank you all. Now we need to have approval of policies. Dr. Dorman?
Yes, these policies were submitted to the governing board by electronically, and hopefully everybody's had a chance to review them. These are joint commission requirements. Probably the only thing of note would be an amendment to the bylaws for New Mexico Behavioral Health Institute. previously, we had allowed contract positions to be voting members of the medical staff, but due to our mix up there where we actually have more contract staff than we have employed staff, which is a different issue, the medical staff up there would prefer that only employed medical staff be able to vote on medical staff issues, which I completely agree with. So that is a change in the bylaws. Other than that, all of the policies, I've reviewed them all for drug commission and CMS compliance, and I'm recommending that we do a consent agenda to approve the submitted policies.
Do I have a motion for a consent?
I will make a motion. This is Jeremy Avarella.
We'll second that. It's Troy Jones.
Got a motion and a second to accept these policies. All in favor say aye.
Aye.
Opposed? The policies are accepted. Approval of credentialing, Dr. Dorman.
Yes, credentialing is kind of a short list this time. For Turquoise Lodge, we have 3 applicants for privileges. We have our new pharmacist, who is a pharmacist clinician, who will be able to provide both clinical services as well as pharmacy services. And oh, by the way, this allowed us to get rid of a very expensive pharmacy contract by hiring a FTE at an appropriate rate. So we appreciate the help that we got from HRB to get this completed. So those are 3. Those applicants have no adverse information on any of their documentation. We're also co-privileging Maria Dahlke, who is the pharmacist, to provide clinical review of pharmacy services at Sequoia. So as we get closer to sharing services between these 2 facilities, this will also allow us to do a small, get rid of a small contract for their pharmacy services, which we were paying an external pharmacist to do that review. So Dr. Dahlke can certainly do that, and we appreciate her willingness to do that. NMDOH has a number. They have 7 members: Franklin Miller, Teresa Smith, the Sharif, Tim Taylor, Mary Bunker, Mark Carrera, Claire Wood, and Chelsea Stolinski. The only thing of note is that Mary Bunker, we're also upgrading her prescriptive authority now to include Schedule II substances, which she did not have before. She only had Schedule 3 through 5, so she made application and gotten approval by the federal FDA and local state to include Schedule II substances. She has also completed her focus review period with an excellent evaluation by Dr. Demet, so she will be good to go for a 1.5 years, which will make up her 2-year appointment. Here at NMDHI, Chuck Ivey, licensed clinical social worker, and Eric Lujan, who is a licensed mental health counselor, will be recommended for credentialing. He will probably be upgraded to privileges as soon as he gets his independent license, which is pending. He took the exam a few days ago, and that's going to take a couple of weeks to get through, so you'll see his name come up before he's a good addition, I think, to our staff. We have public health. We've got 2 certified nurse practitioners, and LLCP, we're bringing on Dr. Grady and Dr. Lyons, and hope that we can maybe include them in some future billing opportunities. And I think they're being billed for right now anyway, but we wanted to just include them just to be all-encompassing with DOH and our privileging function. So the Medical Executive Committee of the Department of Health met on Tuesday afternoon, and we recommended the governing body approve the credentials and privileges for all of these providers.
Thank you. Do I have a motion to approve these credentialing requests?
This is Jeremy Avarella. I'll make that motion.
Troy Jones, I'll second.
We have a motion and a second to approve these credentialing requests. All in favor say aye.
Aye.
Opposed? They are approved.
One additional comment, Joseph Herrera, actually, we're reporting him to the National Practitioner Data Bank for patient abandonment. He literally walked off the job. So he had a client caseload, and so that will go on. He will have the opportunity to comment on that with the National Practitioner Data Bank, but it's our obligation just to let folks know. So that's going to be reported.
Thank you.
Other than that, I have no other further information.
All right, thank you. Are there any announcements that need to be made to the general group? We need to discuss our next meeting date and location. What's the next scheduled date that we have?
January.
Pam, do you have that?
I don't have anything on me.
sometime, usually it's the third Thursday, it doesn't have to be of the month, it'd be third Thursday or approximately in January. Sometimes it's cold, so going north is kind of tough sometimes, like Las Vegas.
So let's pick a location. Where have we not been recently that's accessible in January?
Well,
Nobody wants to come.
Maybe, I would suggest maybe a central location. I mean, we could either do, I don't know if SLD is available or Las Lunas for that time of year, so it minimizes, some individuals would have to travel extra far, and we don't know what the weather will be like during that time.
Las Lunas is pretty good usually, or Sequoia.
Any of the facilities in that area, Turquoise Lodge or Sequoia?
I would recommend we just decide on Albuquerque and then decide on the specific location when we can find out what availability we have.
We have the two facilities. I'm not sure. Sequoia, do you want to host? Is anybody opposed to that idea, or? We're just going to hold it at Chick-fil-A?
It's accessible.
We'll tentatively say that we'll have the meeting the third Thursday in January.
That's the
Sequoia.
21st.
21st, and then we'll send out definitive plans for that later. Any comments from our other attendees at the meeting today before we move into closed executive session? All right, do I have a motion to adjourn to closed executive session?
So moved, Dr. Gorman.
Second.
We have a motion and a second to adjourn to closed executive session. All in favor say aye.
Aye.
Opposed? All right, we are now in closed executive session.